So today we're going to give an update on where we are with COVID-19 and go through some of the data and talk about the measures that we're going to have coming up in the next few days and weeks. Where we are today should be no surprise to most people. We're in a reasonably good place. Since I last provided an update in March, we have continued to see progress that is in the right direction. Transmission, hospitalizations, and deaths are all down since our last report, and this is encouraging. Our approach has always been to only have the minimum necessary restrictions to keep our communities safe, and now we're at a time where we can progress from legally enforceable community requirements to a place of collective being able to manage this together. We are transitioning from having all of our safety levels all of the time to requiring some of them, depending on the situation that we're in, depending on our risk at each time. And on top of the very core protection that we have from vaccination, and we can see that close to 60% of children, 5 to 11, over 90% of adults in British Columbia have received at least 2 doses of vaccine, and close to 60% have received their booster dose. This is important. This level of immunity and protection that we have as a population means that we can move ahead with some other steps. Before I get into the data, though, I would like to take a moment to acknowledge that we have lost now over 3,000 people to COVID in the course of this pandemic here in British Columbia. These are our mothers, our fathers, our aunties, our friends, our loved ones. Even though we are in a much better place today, I know that many families are dealing with the loss of their loved one, and that they've had to deal with this during this global pandemic has been a very challenging time. And I would like you to know that our thoughts and our prayers are with you as well. As we've seen in the last little while, hospitalizations and deaths in British Columbia continue to decline. We know that the cases in green in this slide peaked in early January and have come down steadily. They have leveled off at a relatively low level, and I do need to reflect that this is PCR positive cases. Not everybody who's had COVID. As we know, many people now are using rapid tests and are being able to self-diagnose in the community and take the measures they need without ending up having severe illness and ending up in hospital. So we have been following as well our hospitalizations, and trends over time again are slowly coming down and have been leveling off a little bit, but we need to look a little bit more in depth at who is being hospitalized in our communities across BC. As you know, we moved to reporting hospitalization as a census, so it's everybody who's in hospital with a positive COVID test, and it continues to be that about half of those people are people who are in hospital with an incidental test. So it's not because of COVID that they are in hospital. It is still important to acknowledge that they need to be treated differently in some ways because COVID requires other precautions in hospital. We continue to see, thankfully, a very low death rate. One of the things that we have started very early on is using other surveillance measures to help us understand the impact of this virus on communities. And one of the ones that has been proven to be extremely helpful is the wastewater surveillance that we started in 2020. And we can see that this reflected very well what we're seeing in communities, and it's not dependent on the number of people who are tested. We have seen a steady decrease over the last few months, and a leveling off once again, not quite at the low levels that we were seeing prior to the Omicron wave, but close to those. But in the last week to 2 weeks, we started to see a slight uptick in wastewater surveillance as well. And that reflects, again, the fact that we have opened up, that we are seeing more transmission in the community, even as hospitalizations and severe illness continue to decline. One of the other things that we've been watching very carefully from the beginning is using whole genome sequencing to help us understand what strains of the virus are causing illness in our community. And we can see from this that that darker shade of red is the Omicron BA.2. We have had predominantly the BA.1, and then early on we had a subset called the BA.1.1, and now about 70% to 75% of our cases are BA.2. That's important because that does help us understand why we're seeing a slight uptick in cases, and it's partly because we see from global data that the BA.2 is more infectious and can spread more easily. It does not seem, however, to cause more severe illness, particularly in people who've been immunized, and so that's an important consideration as well. So when we look at who are the people who are more likely to end up in hospital, and are there measures that we can take to help mitigate and prevent them from having that severe illness, we can see over time that it is our elders and seniors who are more likely to have severe illness and end up in hospital. And we see that continues with people over age 80 through this Omicron wave also being more likely to have more severe disease. And that has leveled off and has a slight uptick in the last week. Also, when we look at this, we can see how younger people are less likely to end up in hospital. So if we break this down a little bit further and look at vaccination status, so this helps us understand whether we're seeing breakthrough cases in people who've been immunized, and particularly in people who've received their booster dose or 2 doses of vaccine, whether there's a need for an additional dose. And here in BC, we can see that people who have had their booster dose up to age 70 have very strong protection against severe disease. And this reflects again how the timing of the booster dose, the fact that most people received it within the last few months, and that it gives good, strong protection against severe illness across all age groups. And a reminder for those people who have had 2 doses of vaccine, if you've not yet had your booster, it is important. We see it is incredibly important as you get older, and people over age 70, it does give good, strong protection, but we're seeing some waning of that protection in the last few weeks, and particularly in people over age 80 in our communities with that booster dose still have a risk that is higher than every other age group, except for young people who are unvaccinated. So if we look at the cumulative hospitalization rate over this Omicron wave, we can see that it has differentially impacted people over age 70, and particularly people who are over age 80. And that's one of the most vulnerable areas that we can make a difference right now. If we look at the age-standardized hospitalization, the need for critical care and death rates, across the board, we see that people who are unvaccinated have a much higher risk of being hospitalized, having severe illness, ending up in critical care, or dying. And that booster dose makes a tremendous difference. And what we call this is age standardized. That means comparing a 50-year-old who's unvaccinated versus a 50-year-old who has 3 doses of vaccine. And that protection that you get from that from 2 or 3 doses of vaccine is apparent across all of the critical care markers. The 2 most important factors that we know, and this bears out again and again, are age and vaccination status. And only one of these we can control. We have no control over our age, but we can control our vaccination status and reduce our risk. And it reduces not only our risk as an individual, but it helps reduce our risk of being infected and transmitting it to others. And on a population basis, that means we have protection in our community from various strains of this variant, from Omicron, and from whatever comes next. If we look at our trajectory over the last little while compared to other jurisdictions, we have been able to flatten our hospitalization curve and draw it out, which is really important. That helps preserve our health care system so that everybody who needs it can access it, and so we can reduce the pressure on healthcare workers in the system. And we see that we have a very similar low rate compared to other international jurisdictions. Also see a slight increase in the last few weeks, not as much as apparent in other jurisdictions in Canada or internationally, but something that we need to pay attention to. I also want to present a little bit of the data on the seroprevalence studies. So we've been doing these and reporting on them regularly since March of 2020. And this helps us understand, using samples of blood from people at different age groups in our community, how many people have antibodies to the virus and antibodies because of vaccination. So there's one antibody called the nucleocapsid protein, and if we have antibodies to that, that means we've been exposed to the virus and have developed the antibodies to that specific part of the virus. So it means you've been infected with the virus. Not everybody who's infected gets sick with it, but you can develop these antibodies, and it's a marker of recent infection because they tend to fade away over time. The second antibody is one called the S protein, and that could be either from being infected with the virus or from vaccination. And what we can see is over this course of the pandemic, particularly in the last month with the Omicron wave that we've had, we now have a very high level of people in our population across the board that have antibodies to both the S protein and some to the nucleocapsid protein. That tells us that there's a level of protection, not perfect because we don't have a marker about how much of the antibody you need, but it does tell us that vaccination and subsequent infection in some people means that we have a high level of potential immunity in our community right now that is different from any other phase that we've been through in this pandemic. When we take that into account and we look at the things that are happening right now with increasing activity, with people traveling more, with the slightly more transmissible variant that we're seeing cause infections, we know that we are likely to see a slight increase over time in the next month to 2 months, and then a gradual decreasing again if we continue to do the things that we're doing, in particular to make sure that we're keeping up to date with our vaccinations. The other things that we are looking at, and the data I've presented says, what can we do to help reduce this potential for increase in hospitalizations? And that's looking at who is most at risk and can we provide them with a booster dose that will prevent that from happening. And today we're announcing that that looking at this data, we are going to be offering a spring booster for elders and seniors in British Columbia as the people being most at risk. We know that the older we are, the sooner that antibodies will wane, and the less strong our cell-mediated, those memory cell responses will be. So an extra booster dose right now will provide a rapid increase in antibodies, and we've seen that from data in other countries where this has been used, and will provide that spring protection as we are able to get back to more activities in the community. So it will be available to, we'll be providing it to residents of long-term care at any age and assisted living, and for community seniors 70 and over across the board in British Columbia, as well as for Indigenous people at age 55 and older. And the fourth dose will be at about 6 months from your first booster dose or the dose 3. In addition, we've always had a different program. We've recognized that there are a group of people who are what we call clinically extremely vulnerable. And we know that they needed 3 doses of vaccine to get the protection that most people have from 2. And several months ago, we also put in a booster dose program for that group of people, so a dose 4 at about 6 months. And right about now is when many people who are in that CEV group 1 and 2, the immune compromising conditions, will be receiving their dose 4 as well. So this is going to be a really important measure for us to boost the immunity in those most vulnerable to severe illness and hospitalization as we go into these spring months. Along with that, with this level of community immunity that we have now, we are in a position where we continue to make progress in doing some of the measures that are no longer necessary all the time. One of those is the BC vaccine card, which was very effective at supporting people to get vaccinated, but also during this highest risk period, being able to have these measures in place in those highest risk settings. So it is no longer required under order, so no longer a legal order, but we do know that many businesses are looking at their own clientele and their own people who go into theaters and movie theaters, and some will continue to require this. As well, businesses will transition from COVID safety plans to communicable disease plans. And these were the plans that got us through much of 2021, and we reinstated those COVID-specific safety plans early on in the Omicron wave when we still didn't understand exactly what the conditions were going to be with Omicron. So we're now going back to those safety plans, still being aware in every workplace of the risks and the measures that are important to be in place to reduce the risk to workers in all of those situations. Finally, we'll be removing the post-secondary residence vaccine requirement. We have seen that there are very high rates of immunization in young people, particularly young people who are living in residence in post-secondary institutions, and so this was not felt to be required anymore. Just to go back for a minute to the spring boosters, I wanted to reiterate how important it is for all of us to ensure that we are up to date with our vaccines, and that means now getting a booster dose. We are seeing a leveling off in transmission, but that doesn't mean our province is no longer vulnerable to new and potential variants that are coming in the future. It's important for us to address the risk we have now, but also to think ahead. We're still in a transition phase, and we're still in this pandemic, and we still have a lot of uncertainty of what's coming next. People who don't have the protection that vaccine gives are at the highest risk, no matter what your age. And more data shows us that the booster dose at all ages decreases transmission, doesn't eliminate it completely, but even with Omicron, even with the BA.2, it reduces that risk of infection across the board and provides, as we've noted, very strong protection against hospitalization, ICU, and death. So now is the time to get your booster. If you've had Omicron in the last few months, you can wait up to 3 months, but we know that the booster dose does give you longer and stronger lasting protection, even if you've had Omicron recently. I think it's important to recognize as well that we are transitioning from these broad societal orders where we needed all of these measures all of the time. But it's not all or nothing. We need to learn to live with COVID-19 better, to make sure that we continue our good habits that protect us, our family, and our community. I also want to say, and we've been talking about this on and off for the last number of weeks, but we will be transitioning from the daily numbers reporting to weekly reporting starting this Thursday, April 7th. What that means is that we will be able to automatically link data and have more in-depth and detailed, accurate reporting of numbers of the previous week to get people a better sense of what we expect to see and what the risk profile is. We have, as we've seen, especially during Omicron, when it was very challenging to keep up with the daily manual line lists, we see various swings on a day-to-day basis. So we now have an automated process that allows us to do it in a more accurate and timely way. As well, we'll be transitioning to a new way of reporting people who've died from COVID. And it's going to be looking at 30-day all-cause mortality in anybody who has had a COVID positive test. So that means we will be overcounting people early on, because we know that it takes several days for the linkage to happen between our lab tests and vital statistics. But then as we get the cause of death data in from vital statistics, that will be updated on a rolling basis. And that gives us a more accurate picture of all cause impacts from COVID-19. I do want to just quickly update about the regulated health professionals order. I do want to also say that the changes in use of the BC vaccine card and this order have no bearing on the requirements that we continue to have for all healthcare professionals in our public healthcare system to be vaccinated. That requirement has been incredibly important in protecting our healthcare system through this wave and is important for helping us make sure we're ready for what comes in the future. But we have been working with the 18 regulated health profession colleges to gather data on vaccine status of every registrant, and the deadline for this was March 31st, and the colleges are actively doing that right now. We have good data on most people, but they are continuing to follow up on individuals who may have been on vacation or maternity leave and other things. Our team is now actively compiling this aggregated vaccination data by profession, and I will be reporting that out by profession so people will have an understanding of the vaccination levels in different professions in the community and can make their own informed decisions about their own care based on that. We are also working with the colleges and will be over the next few weeks and months to put in place processes based on risk so that people will have informed consent about whether they want to receive a procedure or a healthcare service from a private practitioner who's vaccinated or not. I do want to say as well that we are working very hard to integrate all of our surveillance pieces. And although we report out on a regular basis on a number of things, we are following a number of other surveillance streams, including a population, what we call sentinel surveillance. We've had this in place for many years for influenza, and we're integrating COVID into that so that we can look at all of the serious respiratory illnesses that we have to deal with and manage in the future. So that includes things like influenza, COVID, RSV, and para-influenza. We're looking at, we will be and continue to do facility-based monitoring of cases and outbreaks. We're expanding our systematic early warning signals through wastewater to areas outside of the Lower Mainland. This has proven to be a really helpful objective surveillance measure, so we'll be expanding it across the province and also expanding the number of pathogens that we can look for using this wastewater techniques that we've perfected over the last 2 years. We'll be continuing to do more frequent targeted serological surveillance. So that's looking for those antibodies in the blood that I've mentioned, doing it in a shorter time frame that helps us understand the transmission of the different respiratory viruses over time. And we'll be continuing with our whole genome sequencing as we've seen how helpful it is in helping us understand the different transmission patterns of the different variants that are affecting people in British Columbia. As we progress forward through this phase of our pandemic, a transition phase, we are in a place where we can go from those mandated requirements to managing things with the good, managing our own health, looking at the good habits that help us protect ourselves, our family, and our communities. COVID-19 transmission continues, but at a much lower level and with a much higher level of community protection right now. But we know that that will wane over time, so we need to build these habits and these tools in that we have now into our future as well. These good habits include the importance of keeping up to date on our vaccination. And that means right now, a spring booster dose for our elders and seniors in long-term care and in the community. But we will be watching and looking at different variants that arise. What might our future be in terms of next respiratory season, late summer and spring and fall? It may be that we will recommend a booster dose for more people. It may be that we will need another booster dose for those who are most at risk. It means paying attention to how we are feeling and staying home if we're sick, using rapid tests to help us make those decisions about whether it is COVID that's causing our illness or not. It means wearing a mask when we choose, or if somebody asks you to, or if you're entering their home or their business. It's about also knowing our own comfort levels and respecting that of others. We need to pay attention to things like ventilation, about the things that help us, enable us to do this, like paid sick leave. There is no magic moment to lift restrictions, and there's no amount of delaying that will make it absolutely safe all the time. So it is something that we need to find this balance. And I believe as we're transitioning through this, we have the tools that we know work. We have vaccination. We have the things that we are getting used to being in the habit of doing, like staying away when we're sick, like wearing a mask when it's appropriate. This is our time to walk through this transition together. And I want to thank everybody across the province for doing their part for so long. It has been a most challenging time, and we are not through it yet. But your kindness and compassion has made the difference in so many ways. And we need to keep doing this together through this phase and as we get to the next phase in the spring and fall. Thank you very much.
Thank you very much, Dr. Henry. And I wanted to just start by joining Dr. Henry in thanking all the healthcare workers across BC for their extraordinary work during this pandemic. One of the areas where this work has been exceptional has been our vaccination campaigns across BC. And yesterday we passed 10 million appointments booked, 11,506,098 vaccines administered, 4,529,770 first doses, 4,358,529 second doses, 2,677,580 booster doses to date. And as Dr. Henry has noted, that effort not only continues, but is significantly expanded today beyond even the recommendations of the National Advisory Committee on Immunization. I just want to put in context the significance of this, that it's focused, as you can see, by the evidence before us, that there are, at present, 595,943 people over 70 who've received their booster or third dose. And that group of people, as they approach the interval period, will be eligible for an additional booster dose. That's significant. In addition to that, there are, in the category of clinically vulnerable, described by Dr. Henry, those who received their third dose, not a booster dose, but the completion of their course of COVID-19 vaccines last fall. That's about 100,000 people in those categories, those people who have are immunity suppressed and have access. And of course, the work that will be going on over the next month in April in long-term care, where essentially all long-term care homes received the option of getting COVID-19, not the homes, but people in the homes, to the option of getting a COVID-19 pandemic booster vaccine in the month of October. April is 6 months from then, and so we will be at all long-term care homes, the vaccine campaign in the month of April. And finally, I'd just like to reiterate a very important point about booster doses, that there are over 70, currently 68,221 people over 70 who haven't received their booster dose and who are eligible for that dose. And I would strongly encourage them today to go on the Get Vaccinated website or to call 1-833-838-2323 and book their appointment today at the hundreds of pharmacies that are currently taking appointments. For example, it is more than ever important for this group of people to get that first booster dose. And I encourage all of them to get it. And I encourage the 1,198,000 people in BC who are eligible for their booster doses to do the same. It is important in these times. It is a critical protection. Evidence shows that. I encourage everyone to do that. And I wanted to thank all those involved in community pharmacy for all their continued work on this issue. Just want to give an update on rapid tests and to let you know about a change in the way we'll be distributing rapid tests in the coming weeks. As of April 1st, BC has received 50,317,800 rapid tests. 40,145,396 tests have been deployed to key strategic areas. As presently noted, just over 500,000 tests in our inventory are not suitable for deployment or personal use. And are being used at the discretion of medical health officers in the appropriate settings. That leaves a current inventory of 9,626,860 tests suitable for self-administered use. Put it in context, to date, 4.4 million tests have been distributed to K-12 schools across the province. 2.13 million tests have been distributed to post-secondary institutions. And 9 million tests have been delivered to more than 1,300 pharmacies across BC. Tests for British Columbians aged 18 and plus and older to pick up a kit containing 5 tests at a participating pharmacy. And as of yesterday, pharmacies have dispensed 4.3 million tests. That's more than 800,000 people have picked up their tests from that source. That's in addition to the tests that have been distributed through the education system and many other places. Our inventories in the province remain sufficient to handle expected demand over the next month. Starting April 8th, therefore, people can access rapid tests at pharmacies with no care card required. For more information on accessing test kits, British Columbians can visit bcpharmacy.ca to make sure the pharmacy has test kits. It's important to remember that testing continues to be something we do when we have symptoms. That hasn't changed. Increased test availability means more members of the general public will be able to access tests to use to understand their own symptoms and illness and to take action to limit transmission to their friends, family, and work, including those at higher risk. And now here's our weekly surgical renewal update. The week of March 27th to April 2nd marks the first week since September in which there were no surgical postponements due to COVID-19. Health authorities report that 6,983 surgeries were completed March 6th to March 12th. That's similar to what we saw in advance of before the pandemic. It's a significant number of surgeries, and it's even more impressive for the fact that it's very close to that number, very close to the number we did in that same week in 2019. As we noted in May 2020 when we made our surgical renewal commitment, and as I reiterated last November, when surgeries are postponed because of COVID, it also means that surgeries aren't booked. And that's why taking care these past few weeks by all of you has been so critical, and why getting vaccinated continues to be critical to reducing hospitalizations due to COVID and the number of people with COVID in our ICUs, so that we can give all those involved in delivering surgeries every opportunity they need to do the work we're counting on them to do. When we know someone who's had their surgery, or we know someone who's now received their call to rebook their surgery, each of us can, I think, appreciate how meaningful this achievement is for everyone. Each surgery is life-changing for the patient who receives it. And to this end, I'll be continuing to meet with all those involved in delivering surgeries and all surgical division organizations as we renew, strengthen, and rebuild and move forward with our surgical renewal commitment and continue to fulfill our promises to patients. Since our last briefing, since the lifting of mandates and easing of restrictions, I think each of us, going at our own pace and adapting to these changes, has continued to make a difference by taking care in our actions and considerations to stop the rapid spread of COVID. It is by taking care, by doing what we know works to keep us and those around us safe, that we continue to give ourselves the much needed opportunity to safely renew. I think for all of us, I want to say, and I just want to say in conclusion, how much I appreciate and continue to appreciate the commitment of British Columbians and the generosity of people in this province. We need to continue to keep steps to support one another and to keep ourselves safe. This pandemic, throughout its course, and this virus, which doesn't care about anything but transmitting, will have As people will know, we are in the basement of the legislature. We're occasionally interrupted by bells, which is, for for people who work here, I think generally a positive thing. So I'll just say that. But it also it clearly is a virus that doesn't care about bells any more than it cares about sometimes our divisions in society around some of these questions. Here in BC, with 94% of adults vaccinated, with the support we've given one another, we have, I think, demonstrated the best possible response to COVID-19 as a community. And I want to thank British Columbians for doing that. There will be more surprises and challenges in the months to come. I know we are up to that, and we are going to continue to keep you informed about the COVID-19 pandemic as we go forward. And with that, I'm happy to take your questions.